I'm Jaideep Gupte. I work at the Institute of Development Studies at the University of Sussex. I also lead the Cities and Sustainable Infrastructure portfolio for the Global Challenges Research Fund and champion the built environment for UK research and innovation. I would like to speak to you about how data and social innovation can help us make cities resilient, safe, and inclusive. There are three key takeaways from my lecture. The first is that safety is a prerequisite for sustainable urban development. In other words, the challenges of mitigating the impacts of crime, violence, and conflict in cities is directly related to the much broader challenge of building urban resilience. Second, that designing, building, and governing urban infrastructure in inclusive ways is as important as turning to policy and social innovation. And third, that local data matters. I will structure my lecture around these three takeaways. 4 global trends to set the scene. The first is that the violence of war has a growing urban dimension. Most of the fragile and conflict-affected states are already predominantly urban, or are projected to be so in the near future. Violence against civilians during and after civil war also occurs predominantly in urban areas. Cities are also the location where a range of criminal violence, homicide in particular, is becoming concentrated. Moreover, 2 billion people living in cities in lower and middle income countries are exposed to multiple hazards such as floods, earthquakes, landslides, volcanoes, and fires, both large and small scale, and this will increase to 4 billion by 2050. You must also keep in mind that cities continually receive those affected by conflict and natural disasters elsewhere. 60% of refugees and 80% of the internally displaced populations are located in urban areas. They rely on everyday urban infrastructure and services. So it is important to understand what drives urban fragility and what makes a city resilient. Because urban risks are multiple, they are cascading and interconnected. These risks are experienced differently by women, men, and children. These risks are also experienced differently in different parts of the city. And so if understanding risk is one side of the coin, the other is understanding resilience. There are many schools of thought on resilience. Our approaches to resilience building must necessarily locate safety amongst other multidisciplinary set of approaches to resilience building. I present here a series of 20th and 21st century examples to illustrate the challenges and innovations in human infrastructure interactions. Now take the example of large-scale affordable housing projects. Now these are essential in providing the first foothold in the city for many who cannot otherwise afford a home. But design flaws in these schemes can make these dark, underserviced, and indefensible spaces. Here is a set of photos from a site in northeastern Mumbai, in which particular public sector housing provision was provided to footpath and pavement dwellers. Now, this was a big win, an enormous win for marginalized groups in the city. But major flaws in the design and construction process mean that the buildings are so close to one another that natural light is restricted. School children find the narrow alleyways too dark to walk through. Garbage collection becomes a problem, as does providing fire safety and police services. And the water pumps, for instance, lay dormant for all but a few minutes in the day due to the lack of provision of municipal water. Now, one of the key safety nets in this neighborhood is the women's cooperative called Mahila Milan, which provides low-cost loans to the community. Women volunteers who help run the cooperative use their daily contact with clients to also help resolve conflict and keep a watchful eye on cases of domestic violence, for example. Slum dweller groups in the city of Mumbai have also formed what are known as mohalla committees or neighborhood committees that bring together slum dwellers and city police in formal neighborhood-level partnerships to deal with criminal intent before it leads to crime. Now, these very mohalla committees helped heal the deep wounds left by the citywide riots in 92-93. When addressing the challenges of building safe and resilient cities, it is important to recognize, however, that the priorities and life goals of at-risk groups may shift rapidly over time, but also by gender. Local data is therefore critical in understanding the multiple cascading and interrelated risks people face. However, based on their priorities, the priorities of at-risk groups, and other relationships in the city that they may have, people may choose to have different aspects of their data, different aspects of their personal lives shared and put into contact with official channels in the public domain. In a study of informal settlements in the cities of Dhaka, Chittagong, and Bogra in Bangladesh, for example, we found that people's subjective assessment of how they fare on their own well-being priorities and their observable well-being outcomes are substantively mediated by site-specific governance arrangements for essential services. However, urban policymakers often lack the methodologies and metrics to support interventions that are relevant to well-being dynamics in particular localities. Now, because people in cities and towns can prosper, but they're also not immune to failure, we found it important for local authorities to take cognizance of the priorities of those who are thriving, but also priorities of those who are merely surviving or indeed failing. Vulnerable though they may be, they have a range of life goals and priorities, and these require a diverse range of engagements with different parts of the welfare state. In another example from the city of Medellin in Colombia, where a system of gondola cable cars was built to connect poor and previously disconnected neighborhoods on hilly slopes surrounding the city to the city center. Now, this provided access to jobs and services that were available in the city center. Now, as a spillover effect, the city found that homicide rates in these neighborhoods decreased dramatically, as did the reporting of other forms of violence from the residents of these neighborhoods. Now, this simple and relatively everyday infrastructure enabled a route for those previously marginalized to claim their rights over the opportunities the city has to offer. Similarly, simple and everyday digital infrastructures can provide routes to safeguarding citizens' rights. In Argentina, for example, the justice system was recognized as the institution with the lowest public trust, and judges were often perceived by the public as non-transparent, inefficient, and distant. The city of Buenos Aires broke long-standing norms, and their criminal courts began to publish every judgment, every hearing, even staff resumes and judges' personal opinions on the official Twitter account. Now, using this fairly common social media platform was actually an enormous cultural shift for the courts. And interestingly, this cultural shift towards using digital infrastructures to democratize governance has contributed to the long-run preparedness and resilience of the city. The city's criminal courts have been able to rely on existing technologies to conduct hearings on urgent domestic and gender-based violence cases, for example, through the lockdown period of the coronavirus pandemic, where physical distancing and lockdowns have precluded physical hearings. But access to digital infrastructure is not equal. The connected smart city is a reality only for some. 3.6 billion people continue to live without affordable access to the internet. Amongst the world's 47 least developed countries, more than 80% of the population is still offline. And while we do need to take dramatic steps to address these inequalities, we need to ensure that it is not at the cost of people's rights to privacy, and doing so does not undermine democratizing urban governance. Here are some examples from cities across Africa where digital infrastructures have enabled democratic outcomes. It is interesting to note in this example, when at-risk urban dwellers are asked to use their own words to describe the risks they face, they are quick to put any preventative measures in the context of creating and contributing to healthy functioning of the city, rather than on interventions involving heavy policing or incarceration. Similarly, this is an example of an app called Safe City, that uses storytelling as a way to locate gender-based violence in the city of Mumbai. The data from this app too shows that victims of gender-based violence focus their remedial and transformative interventions, focus on transformative interventions rather than on custodial or punitive measures. In contrast, there's evidence to show that heavy-handed policing or militarization of urban space can be counterproductive. A randomized control trial in the city of Bogota, for example, shows that intensifying police presence in neighborhoods with high prevalence of crime only had modest direct effects, reducing homicide only by 5%, but property crime, for example, was only displaced elsewhere. Now compare this to evidence from Kailicha, one of South Africa's poorest and most violent suburbs, where violence prevention through urban upgrading has been applied for second-generation crime prevention through environmental design, including built environment interventions. Here, a focus has been to pair built environment interventions with enhancing the social side of territoriality and community members' motivations to exercise control over their environment. An evaluation of these interventions shows that living in close proximity to the upgraded urban infrastructure was associated with a significant reduction in exposure to interpersonal violence. And therefore, the association between urban upgrading and reduced exposure to interpersonal violence supports its inclusion amongst interventions in national and local crime prevention policies to address social and structural environments. In conclusion, I would like to leave you with 4 key messages for creating cities that leave no one behind. The first is that we must use innovative measures to accurately understand people's vulnerabilities. We must rely on the rich history of participatory urban appraisals to understand the vulnerabilities to violence, to insecurity at the street, the neighborhood, even the city level, but integrate with community-driven self-monitoring practices to provide communities with critical real-time data to meet their own advocacy needs. Second, we must support evidence gathering from small and medium-sized towns alongside larger cities and analyze safe and resilient urban spaces alongside the more fragile ones. Third, police reform remains a key intervention for national and city governments. We know that place-based or hotspot policing displaces crime and has a limited impact on crime, while militarizing urban space can have negative side effects. On the other hand, successful strategies have built credibility and legitimacy of police functioning by promoting community policing collaborations. Planners, designers, and municipal administrators therefore need to treat the police and emergency services as equal and key stakeholders. And lastly, inclusive cities and towns need to also be welcoming of displaced people and other migrants, and be assured that others will do the same. Cities cannot do it alone. Otherwise, we may worsen the situation of rural-urban migration. We're in a context where 60% of all material and physical infrastructure required to accommodate the urban population in 2050 is yet to be built. So this constitutes an important juncture to place the right science into contact with the right policymaking to enable the human infrastructure relationship that are nurturing. In our desire to make cities smart, we must not become driven by technocratic goals, but use technology as a means to a more democratic end. Rather than militarizing urban space, we need to use digital and social innovation in tandem to leverage the power of the informal economy and seek to provide an aspirational life with good health and well-being outcomes for all city residents.